Hey guys, so I just want to record a response to an email because I think this response will help other people. I'm going to read the email in segments. I'm going to reply. So this is going out to one of our members. The member said they received a phone call from a mobile patient wanting LSVT big. First thing, I've got to put it out there. You've seen my content. The LSVT big is not a covered benefit in and of itself. We can use elements of it to provide covered services, but the program itself is not a covered benefit. It is not recognized by Medicare. It's not paid for by Medicare. Medicare doesn't care what LSVT big says or does or anything. So that being said, though, you can use elements of the program to provide covered services. So then the email goes on. This particular patient has an Aetna Medicare Advantage plan, but the therapist is only credentialed with Medicare Part B. They have the patient's date of birth, the patient's name, the insurance number information. They're not sure how to look up out-of-network benefits. So the traditional way you would verify out-of-network coverage is you would call the insurance company, you would call Aetna, you would give the CSR, customer service representative, the information that you have on the patient. You would give the CSR your MPI, maybe your tax ID number. You would inform them that you're an out-of-network provider calling to verify out-of-network coverage. And you might get information that way, but it's always questionable. I'm going to tell you, you're not required to verify coverage for Medicare Advantage. We know that the Medicare Advantage plan either it does have out-of-network coverage or it doesn't. In either situation, if you use the Medicare Part B physician fee schedule to estimate the cost of the service, you are going to be either at or below what the plan allows. If the Medicare Advantage plan does have out-of-network coverage, you just cannot charge more than the plan allows. The plan is required to allow at least what Medicare would pay. Might allow more, but it has to allow at least what Medicare would pay. If the plan does not have out-of-network coverage, you're not obligated to charge what Medicare allows or what the plan allows because there is no allowed. You can bill your full bill rate. But I would say the best option here is save the time. Don't verify coverage. Don't go through any of that. Just make your bill rate what Medicare Part B allows for the services and charge the patient at the time of care. So the email goes on. I looked up Aetna's website. Different plans look like they're usually 50% out of network, coinsurance. Yeah, that's possible, but you don't know what the allowed amounts are other than assuming it's based on the Medicare Part B fee schedule. Does this mean the patient would pay half and then the insurance would pay half? It would. That would be the typical for a 50% coinsurance. Now you go on in this email to say if your average visit is $100, the patient would owe you $50. Theoretically, yes, but $100 is going to be below the Medicare allowed amount. So I would tell you, charge the patient the Medicare allowed amount. That should already be a discount on your full bill rate because your full bill rate should be 2 to 2.5 times the Medicare allowed amount. You can provide them a prompt pay discount. If you're absolutely dead set, you absolutely will not charge the patient more than $100 a visit. You can do that. Technically, the patient should pay you $100 at the time of service. You would provide the patient with the required documentation to submit on their own to their Medicare Advantage plan, and then the patient would receive back technically $50 from Aetna's coverage. So the patient pays you $100, you give the patient the documentation, the patient submits on their own behalf, they get back a check from Aetna for $50. Okay, the email goes on. Can I even bill the company if I've not gone through the credentialing process? So for a company like Aetna, Humana, and Mutual, by default, you're automatically out of network. Yes, you could technically bill the company, but I don't think you should go down that road. That road is a lot of headache and a lot of hassle. You give the patient the documentation, let the patient bill on their own. There's 5 documents. If you go into module, I think it's 6, I explain all of that. But give them a CMS 1500, give them a W-9. It's an IRS document. Give them a copy of the referral, give them a copy of the evaluation, and give them the treatment notes. You give them those 5 things, you give it to them once. If they want it again, you're going to charge them for additional copies, and you inform them that this is everything that you have. There's nothing else you can do. This is what they submit to their insurance company for reimbursement. And you tell them to make their own copies, or else you're going to have to charge them if they request additional copies. It says here you signed up for Availity. Awesome. You can verify coverage through Availity, but it does take some time to get Availity up and running. So I hope that answers your questions. I hope that helps everyone else in the group. It really goes back to, one, you can charge a cash rate for LSVT Big, as LSVT Big is not a covered service. If you want to use LSVT Big within a covered plan of care, you can, but this would be just like the patient coming to you and say, I want to do golf performance, I want to do gardening, I want a recreational activity, I want to do boxing, right? Rocksteady, that's a boxing for Parkinson's. It's not a covered benefit. Yes, we can use boxing in a covered program under a plan of care, but Rocksteady itself is not a covered benefit. So I hope that gives you some context. Let me know if you have more questions.